Many women experience it at some point in their lives, yet very few are ever given a calm, complete explanation of what it really means. Vaginal discharge is one of those topics that creates confusion, embarrassment, and unnecessary fear, not because it is rare or abnormal, but because it is rarely explained in a balanced way. Some women are told it is completely normal and should be ignored. Others are told it is a serious problem that must be stopped immediately. The truth, as it usually is with the human body, lies somewhere in between. Vaginal discharge is a fluid that comes from the vagina. It may appear clear, whitish, milky, sticky, watery, or stretchy, depending on where a woman is in her menstrual cycle. For many women, it leads to dampness of undergarments and a feeling of discomfort. This alone often creates worry. The first question most women ask is whether this is normal or not, and the honest answer is that sometimes it is, and sometimes it is not. The key lies in understanding when discharge is a sign of healthy function and when it is a signal that something inside the body needs attention. From a modern medical perspective, vaginal discharge is often considered normal if it is clear or white, does not have a strong or unpleasant odor, and is not accompanied by itching, burning, pain, or irritation. According to this view, discharge plays a role in keeping the vaginal environment clean by flushing out dead cells and maintaining a healthy balance of microorganisms. Many gynecologists reassure women that as long as there is no foul smell or discomfort, there is no cause for concern. However, traditional systems of medicine, particularly Ayurveda, take a more conservative view. Ayurveda recognizes that the female body is delicate, cyclical, and deeply influenced by internal balance. According to Ayurvedic understanding, vaginal discharge is considered normal only at specific times, such as around ovulation or shortly before menstruation. Discharge that occurs regularly outside of these windows is viewed as a sign that the body is losing something essential. In this view, vaginal discharge is not merely a cleaning mechanism, but a loss of vital fluid that, when excessive or persistent, can weaken the body over time. This difference in perspective often creates confusion. Modern science tends to focus on whether discharge is infectious or not, while Ayurveda focuses on the long-term impact of continuous fluid loss on a woman's strength, immunity, and hormonal balance. These perspectives are not necessarily in conflict, they simply look at the same phenomenon from different angles. When combined thoughtfully, they offer a more complete understanding. Many women who experience frequent discharge also report symptoms that seem unrelated at first. Persistent fatigue, lower back discomfort, headaches, joint stiffness, hair fall, dull skin, irritability, and low immunity are often reported alongside chronic discharge. From a modern standpoint, these symptoms may not be directly linked. From an Ayurvedic perspective, they are connected through the concept of gradual depletion. When the body loses fluid repeatedly without adequate restoration, overall vitality can decline. Another area of concern is reproductive health. Ayurveda holds that chronic vaginal discharge can weaken the uterus and disrupt the delicate balance required for conception. While modern medicine may not always emphasize this connection, many practitioners acknowledge that chronic inflammation, infections, or hormonal imbalances associated with abnormal discharge can interfere with fertility. This makes understanding and addressing the root cause especially important for women planning pregnancy. To understand vaginal discharge properly, it is essential to understand what causes it. One of the most common causes is disruption of vaginal hygiene. The vagina is a self-regulating organ with its own natural balance of bacteria and acidity. Practices such as frequent douching, use of perfumed soaps, harsh cleansers, and scented products can disturb this balance. When the natural environment is altered, the body often responds with increased discharge as a protective mechanism. Ironically, many women try to reduce discharge by cleaning more aggressively, which often makes the problem worse. Hormonal factors also play a significant role. Synthetic hormones found in certain birth control methods can alter the natural rhythm of estrogen and progesterone. These changes can increase vaginal secretions in some women. Antibiotics, while necessary in many situations, can also disrupt the balance of healthy bacteria in the vagina, leading to abnormal discharge. Digestive health is another important but often overlooked factor. Chronic constipation or poor bowel clearance increases internal heat and toxin buildup. According to Ayurvedic understanding, this excess heat can manifest in the pelvic region, triggering vaginal discharge. Even from a modern perspective, gut health is closely linked to immune function and inflammation, both of which influence vaginal health. Stress also plays a role. Chronic mental stress affects hormonal regulation and immune response. When the body is under constant stress, it becomes more susceptible to infections and imbalances. Many women notice changes in vaginal discharge during periods of emotional strain, illness, or exhaustion. not all vaginal discharge is the same, and changes in color, consistency, smell, or associated symptoms provide important clues. Thick, white, clumpy discharge that resembles cottage cheese is commonly associated with yeast overgrowth. This type of discharge is often accompanied by itching, irritation, or burning. Yeast thrives in environments high in sugar, which is why diets rich in refined carbohydrates and sweets can contribute to this condition. Hormonal contraceptives and antibiotics can also increase susceptibility by altering natural defenses. Gray discharge with a fishy odor is typically associated with bacterial vaginosis. This condition arises from an imbalance between good bacteria and bad ones in the vagina. It is not necessarily caused by poor hygiene, but rather by disruption of the vaginal ecosystem. Use of perfumed products, douching, and changes in sexual activity can all contribute to this. While bacterial vaginosis is not always dangerous, it can increase the risk of other infections if left untreated. Brown discharge is often related to menstrual irregularities. It may represent old blood being expelled from the uterus. This can occur before or after a period, or when cycles are irregular. While occasional brown discharge is usually not concerning, persistent or unexplained occurrences warrant evaluation. Yellow or green discharge, particularly when accompanied by foul odor, itching, burning during urination, or pelvic discomfort, may indicate a sexually transmitted infection. In such cases, prompt medical evaluation is important. These infections require specific treatment and should not be ignored or managed solely with home remedies. Clear discharge that is watery or stretchy, resembling egg whites, often corresponds to ovulation. This type of discharge supports fertility by facilitating sperm movement. From a modern perspective, this is considered a healthy sign. Ayurveda, however, views excessive loss of this fluid as potentially depleting if it occurs frequently or in large amounts. Again, context and frequency matter. Ayurveda refers to excessive or abnormal vaginal discharge as Shweta Pradara. Ancient texts describe it as a condition that arises from imbalance of bodily energies, particularly excess heat and weakness of digestive fire. According to this system, treatment focuses on cooling the body, strengthening digestion, and restoring balance rather than suppressing symptoms. One of the simplest remedies described in Ayurvedic practice is rice-washed water. This preparation involves soaking rice and water and consuming the strained liquid. It is believed to have cooling properties, reduce internal heat, and support overall balance. From a nutritional perspective, rice water contains small amounts of minerals and antioxidants that may support hydration and gut health. When consumed regularly over time, it may help reduce symptoms associated with excessive heat and irritation. Another traditional remedy involves the use of specific plant leaves known for their astringent and balancing properties. These plants have been used for generations to support vaginal health and are often described in classical texts as strengthening and restorative. Their role is not to block discharge abruptly, but to help the body return to a balanced state. Herbal formulations described in Ayurveda are often complex combinations designed to address multiple systems at once. These formulations aim to support digestion, improve blood quality, strengthen reproductive tissues, and balance hormones. Unlike modern single compound drugs, these preparations work gradually and require consistent use under guidance. Dietary adjustments are considered essential. Excessively spicy foods, refined sugars, deep-fried items, and carbonated drinks are believed to increase internal heat and aggravate discharge. Cooling, nourishing foods that support digestion and hydration are encouraged. Regular meals, adequate fiber, and sufficient water intake help maintain internal balance. Clothing choices matter too. Tight, non-breathable fabrics can trap moisture and heat, creating an environment that favors irritation and microbial imbalance. Loose, breathable materials support airflow and comfort. Hygiene practices should be gentle and minimal. The external genital area can be cleaned with plain water or mild, unscented products. Internal cleaning or douching is unnecessary and often harmful. The vagina is designed to clean itself, and interfering with this process can disrupt its natural defenses. What is important to understand is that vaginal discharge is not a disease in itself. It is a symptom. Sometimes it is a sign of normal physiology. Sometimes it is a sign that something is out of balance. Treating it requires understanding the context, frequency, associated symptoms, and overall health of the woman. Modern medicine and traditional systems both offer valuable insights. Modern diagnostics help identify infections and structural issues. Traditional approaches emphasize long-term balance and prevention. When used together thoughtfully, they provide comprehensive care. If discharge is sudden, severe, foul-smelling, painful, or associated with bleeding, medical evaluation is essential. Home remedies should never replace proper diagnosis in such cases. However, for chronic, non-infectious discharge linked to lifestyle and imbalance, resistance. Gradual, supportive approaches can be beneficial. The most important message is this: the female body communicates constantly. Vaginal discharge is one of its languages. Learning to interpret it correctly prevents fear, shame, and neglect. It empowers women to respond appropriately rather than react impulsively. Health is not about suppressing symptoms. It is about understanding signals. When women are given clear, respectful information, they are better equipped to care for themselves. I am Dr. Iris Amelia. My goal is to bridge understanding, reduce confusion, and support informed choices. The body is intelligent. When supported properly, it moves toward balance. Thank you for listening, and I will see you in the next conversation.